Welcome to Porchlight, a presentation of Porchlight VNA and Home Care, providing top-rate, highly personalized care to individuals and families in the Berkshires and also in the hill towns of Hampden and Hampshire counties, all in the comfort of your own home. And I'm very happy to welcome to the program a partner with Porchlight, because in this world of healthcare, especially for our senior citizens, it can be very complex, and you need a partner and you need an advocate. And with that, the Executive Director of Elder Services of Berkshire County, John Lutz, is with us and works very closely with Porchlight VNA. And with Porchlight, we have Holly Chaffee, who is the Chief Executive Officer. So both of you, welcome to the program. It's great to have you.
Thank you.
Good to be here.
And it's great to have you. And I can tell you that when it gets to that time, when a senior and a loved one in a family starts to have some health troubles, really, it is a complex world out there to know what is the next decision to make. Where can we go? Is it assisted living? Do we have home care options? That sort of thing. So, John, your organization is really that sort of liaison, that helpful partner for many people in the community.
Well, and at Elder Services, our goal is to meet the person where they are and their family, their network, and say what can be done to help you stay as independent at home for as long as possible with the highest quality of life possible. And all the state and publicly funded programs, what can we figure out? What care plan can we cobble together based upon what you've told us and what we've seen? And we have caseworkers that meet with folks, we have nurses that meet with folks, and we try and put together kind of a care plan that might call into work partners in the private sector, partners in the public sector, to say this is what will allow this family and this elder to stay as independent, as high a quality of life, and at home for as long as possible.
And looking at that, many people feel that way, and I think both of you do, is that being able to age in place is perhaps the best way to go, to be able to stay within your home. And I know that's your philosophy, Holly. And so today, now more than ever, I think with the sophistication of the services that you provide, I think that's more possible than ever.
Absolutely. We certainly believe that all people can be maintained at home, those from the ventilator patient to the person who just needs some assistance with cooking or laundry. And at Porchlight, we provide that continuum of care from acute to chronic care. We have a home visiting nurse practitioner. We have the private pay component of our business, where we have personal care attendants, homemakers, companions. We even have live-in caregivers. And then on the certified side, we have the nurses, the physical therapists, occupational therapists, social workers, and just the whole gamut. Anything that anyone needs, we can provide in the home. We even do transportation through the Porchlight Home Care. And we partner on a number of things with Elder Services. I think one of the key things is that if a person has an income of less than $2,024 a month, then we
It's a very specific number.
Yeah, it's
$2,000 to 24.
Yeah, and it goes up incrementally by a few dollars, so you have to keep changing. But then we can refer that person to Elder Services to see what programs they can provide under the plan of care for each individual patient. So our social worker will go out as part of, say, a Medicare episode of care where we're providing home health aides and physical therapy. And then we identify that their income level is that and say, wow, did you know that potentially you could benefit from some of the services under this program? And they said, no, we didn't know how to connect to that. And so we'll call Elder Services and make that referral, and then our staff will talk with the staff of Elder Services, and then John's staff will go out and do an assessment and an evaluation of what they can provide for that person.
And John, many people, when they think of Elder Services, the first thing they think of is Meals on Wheels. It's a very visible program that you have, but it's just one, not small, I mean, it's a pretty large facet of what you do, but it's just one portion of what you do. So how would you describe the mission of Elder Services and sort of the full range of offerings that you have?
Well, I think, if you boil it down, the mission of Elder Services is to allow people to age in place with the highest quality of life possible, and to bring together, we don't provide a lot of direct service, but we are the care coordination entity for lots of folks. So our, in a sense, if we think about our partnership with Holly and with Porchlight, we have about a $12 million budget total. Half of that, $6 million, goes to vendors like Porchlight to provide the care that we've assessed. I mean, we are monitoring, but we don't actually provide the care. So we play that role of the caseworker, the broker, the conduit from the dollars to the actual care to allow that person to age in place. And then we have other programs that money management that helps people who may be having trouble managing their checkbook. If we can manage their checkbook, they can pay their bills, they can pay their rent, they can remain in their home. So everything we do really has that as a focus. What can we do, what service, what support, what volunteer can we bring to allow this person, this couple, this family to remain living and aging in place as they choose?
And so you are a nonprofit organization, but in a way you're kind of almost a quasi-government type of organization, because you're maybe not providing regulation, but you're certainly helping with decision making, and then even almost a layer of oversight, because you have your ombudsman program in the long-term care facilities as well. So you're kind of an interesting animal.
We are. We are a local nonprofit. We're a 501c3. We have a local board, all those things. But by far and away, the largest source of our funding are contracts that we have with the state of Massachusetts. So the state of Massachusetts is required to provide this service, this coordination of care and these services, and they've chosen to do it through a network of local nonprofits. Other states do it, maybe at the county level. There's county departments of aging, there's state department of aging. So, but the Executive Office of Elder Affairs for Massachusetts contracts with 27 agencies like Elder Services of Berkshire County across the whole state, and that's how they convey and get the services out to all the clients that are eligible.
That's very interesting. And looking at that, of course, we're always interested because you talked about the funding. What is the funding like? The governor just came out with the proposed budget for the upcoming fiscal year. So how does that look?
Well, for this year, the headline I came to this morning from our association on my email was, "The governor saved his best elder budget for last." That we feel this budget is actually more supportive of elders than maybe most of his previous ones. It's just a starting point, and we know there's lots of the legislative process and the budgetary process to go through, but it does bring additional funding to elder services, specifically in those areas that provide the most basic services. Basic home care, in-home services, purchase of services, so those that will allow more services to be brought to the clients that we have, and that's where the emphasis really needs to be.
Which is very interesting, Holly, because we've heard quite a bit, and from this governor and from others who have said that the ideal place for people to age is within their homes, but sometimes the money hasn't followed the rhetoric, right? So it's good to see that. So the philosophy is there, but the dollars are important.
They are, and people sometimes don't understand how do they qualify for the services, or how come this person has more service than I have, and there are certain criteria that have to be met under the elder service programs, which John can speak to, so that it'll give them different levels of care. And different amount of care, but it's not like an endless pot of money to provide the care, so they have to look at all the elders that they service and say, okay, we have this much money, how do we split it up by the needs that the people have? So it's based on, their ADLs, activities of daily living, what do people need assistance with, and how can we help them?
And interesting because, again, talking about that philosophy of having people age in place, as the term is used, there is a pilot program now that is actually encouraging the idea that people who actually today may be in long-term care facilities to actually be brought back into, as John, you would say, in the community, back in their home.
Right.
So that's actually happening right now.
Yeah, we're in the midst of a 5-year project, the pilot project that the state of Massachusetts is involved with the Centers for Medicaid and Medicare from the state, or from the feds. But the whole idea is that there are people living in long-term care facilities who are both capable of living in the community with supports and would like to live in the community with supports. And I think the big change that's happened is that it's opened up a much broader variety of possibilities, everything from group homes to adult family care, to congregate living, to living on your own. So it's created a situation where you can work with an individual, figure out what they need, and then go into the community and try and create that support network. But you've got a lot more flexibility because what essentially the program's called Money Follows the Person. The money that's being spent publicly in the facility is now going to follow them into the community. So you've got kind of a basis to work from. And as Holly mentioned earlier, I mean, almost anyone in these days with technology and supports can be brought into the community and sustained there in a safe and medically healthy way. And so there's just more possibilities now about having people be out of long-term care facilities and living in the community. It may be in a group setting, it may be in a supportive setting, but still it's in the community versus being in a long-term care facility.
And Holly, sometimes sometimes the unfortunate thing with decisions that are being made for healthcare is that and I think both of you find this, is that these decisions are often made very late or in the period of crisis. So therefore, people are forced to make decisions as opposed to perhaps being educated further on and easing their loved ones into a scenario where they are getting support. I mean, is that something you find?
Absolutely. People tend to shy away from conversations that are uncomfortable. And one of the conversations that's uncomfortable for adult children, say like myself, to talk to their parents about are, what are your plans for the future? What do you expect of me as a child, as an adult child, if something was to go wrong? What can I do to help you? And, what are your expectations? Do you think I'm going to come back to New Jersey to take care of you? Are you going to, move up here to the Berkshires so that I can care for you? What are your thoughts behind that? And those are conversations that if people had those conversations early on before there's a crisis with their family members, it would be a lot easier to provide care later on. So if you recognize that your parents are having some concerns, or if you have a disabled person in the community that really needs a little bit of help, it's not taking away all of their independence to call and talk to us and have us come out and sit in the conversation. We're happy to meet with the parents and the adult children and say, okay, we can facilitate this conversation and let you know what resources are available so that when something does come up, number one, you know what the resources are, and number two, you recognize that we're going to help you to stay as independent as possible for as long as possible in the least restrictive environment, which is your home. And whether your home is in an assisted living or whether it's in an independent living or in a private home, we can provide services in any of those places.
And some of those simple changes can make a big difference as opposed to having this sort of crisis and then it's like, oh my gosh, we're going to have to go into a nursing home or we're going to have to bring mom or dad into at least assisted living. But often, we learn about individuals who are going through this process, make sure one floor living is also an option, independent living, these types of things, and those who are planning for it often do a lot better, Holly, in the end.
Yes, years ago, the family structure was you had a high-rise or a two-family kind of house, and you had the older people lived on the bottom floor, and the people who were having children lived in the mid-floor, and then the youngest people lived on the top floor, and that structure, I think although we're going back to it now because of the economy, I think that structure just isn't there right now. And so we find that many of our patients, their family members, their children live in Texas or California, and they really want to take care of their parents, but that's where their jobs are and that's where their lives are, and they want to maintain their lives but still coordinate that care at a distance. And so with the technology that we have today, we're able to keep them more involved in the care and the conversation. I know in our private pay company, we have a portal where the families can check in and just get online and look and see who's coming, which aide or which homemaker or which caregiver is going to the house at which time, and they can see, the whole picture, so that if they say, oh, you know what, I forgot to tell them mom has a doctor's appointment on Friday and my brother's going to be taking her, so I should let the agency know so the aide doesn't show up and knock on the door and nobody's there. So it does help with the coordination and the communication. One of the things we do well with Elder Services, one of the many things, is we coordinate the care plans for the patient, because every patient has an individualized plan of care. And our nurse and caregivers will coordinate with the case manager of Elder Services for the services that we contract with them. And they oversee the case, and we both comply with the regulations, and the communication is really the key to making it a successful plan for the patient and care at home.
Yeah, so John, take me through again, there's no typical case. Every case is unique and individual to the family and to the loved one. But, what is the typical scenario for someone to be contacting Elder Services? And then how does that work when a social worker, I presume, comes to the home? How does it typically move forward from that point?
Well, usually we'll get a phone call from a daughter. It's almost, the majority of the time
Yeah,
it's a daughter who will call and say, my mother, my father is having some trouble. What might they be eligible for? I live in Boston, and they live in Adams, and what could we do? Still living in their own home. So what will happen is that it'll go to our information referral office, our staff there, and they'll do a quick assessment. Appears that they're eligible for home care. Then it'll be referred over to our home care caseworkers and nurses. And between the nurse and the caseworker, they'll go out and visit the person in their home and do a very extensive assessment. And when I say extensive, over 300 questions to say, what's the environment they're in, what are their capabilities, what are their supports. So to really get a full picture of what they are capable of doing, what they're having trouble with, what are their resources, and the nurse will participate and do the same. What can they do safely, what can they not do safely. We had someone who was reluctant recently to take services, and we said, well, are you having trouble? And she said, oh, I have a little trouble going up and down the stairs. And then when we went out and saw and visited with them, we realized that their laundry, their washer and dryer were in the basement. Well, how does that work with trouble? Well, I just stand at the top and throw the basket down, and then I go down, and then and so we're like, well, we could maybe get you some help with your laundry, or we could, so. There's no substitute for going out and spending time with a nurse and with a caseworker in their home and seeing, what is the environment they're actually living in, and what does the house look like, and, do they have other issues going on, is there hoarding, or, is there an unsafe situation with a pet, or, or is there heat, and so those kinds of things. So I think, when it goes from kind of a phone call to the in-person visit, and then the development of a care plan, which may involve a vendor such as Porchlight providing services, but putting together that care plan about, well, what's really going on in this household with this senior, and what can we do to support them? And there may be things that have been let go, and we can help them get them back. Maybe they're having some trouble paying their bills, and we get them a referral for a money management volunteer. Maybe they are no longer driving, and yet they need to get to medical appointments. We can get them a companion to help drive them to medical appointments. So it's really going out and assessing what's kind of going on, not just with the senior, but kind of what wraps around the senior, either in a positive way or a negative way.
Yeah, and I think that also, some of the things that you say there also are good arguments for why things like rehab and other types of services make sense to be happening within the home. For instance, Holly, because on the VNA side, with those rehabilitation services, PT and OT, I mean, yeah, you could work in a quote-unquote OT kitchen in a facility, but it's not your kitchen.
That's right.
Yeah, and if you're home in your kitchen and home walking up your steps, obviously to be able to achieve that means you are truly independent. So that makes a big difference.
It does. And one of the things that our clinicians are really expert at is identifying what those things are when they just, from the time they step out of their car to go into the house to entering the house and then getting inside. And you just learn a lot about what a patient needs when you step in their front door, and even just onto their property. Is the driveway, mountainous or slippery, or is it, is it dirt, is it tarred, is it, what are going to be the risks here for this patient? And it's just really important to include the patient in their care. And I think that's one of the big goals we have now, is to move toward a prevention of care in the home, and preventative models, and getting the patient to take responsibility for their own health and care, and finding out, like, okay, we're here to help you. Now, what are your goals? What do you expect of us as an organization to help you do while we're here? So, for example, the person who fractures their hip and is used to being out at work, it's challenging for them because they can't even get out to the mailbox to get their mail. And so that's what, one person would say, well, I really just want to go get my mail every day when it arrives, so I can, get to it. And so we set up those goals with the person. What do they want to do? Is their goal to go to their daughter's wedding in 6 months? What kinds of things can we make happen? And all things can happen. It's just putting the right services in place. One of the programs that we are partially funded by with Elder Services, and a mini grant that they gave to us, is a fall prevention program. And it's a 6-week program that we provide in a variety of communities throughout Berkshire County to help people learn that how not to fall. And each week builds on the next week. And people are like, wow, I didn't even realize I was a fall risk. And I'm glad you taught me these things, because now I'll know to pay a little bit of attention, just the smallest things. Another partnership we have with Elder Services is the one-time nursing visit grant. And so we have a small amount of funding to be able to provide a one-time nursing visit out to somebody to see if we can assist them with a need. And that money has been very helpful, and that need seems to be growing out there. And then there's actually even another program I'm thinking of, is the Elders Back to Work program, where we employ through Elder Services individuals that are retired but want to get back into the workforce and need to learn a different set of skills. So we act as a host agency for training. We presently at each company have one individual that we train to gain phone skills, clerical skills, and look at the individual and their resume, and try to help them gain the confidence to be able to get back to work in the program.
And just talking about the in-home and doing the assessment, the big part of that is often it helps our caseworkers, and certainly we work with the nurses and social workers and aides that Porchlight sends as well. But sometimes it can help you identify dangerous situations, whether it's an elder that's neglecting themselves, or maybe being neglected by a caregiver, maybe being taken advantage of financially by friends, family, neighbors. So, that's another part of being in the home, seeing what the environment is, and really understanding, what's kind of going on here. Something, you have lots of people coming and going, and who's the financial engine of this, whatever this group is, because sometimes it's the elder, because they have the most reliable income, because they're getting Social Security or a pension, and that's the money that's really supporting kind of a conglomerate of individuals, but maybe not going completely to the elder.
Yeah.
And so going out into the home and going into the community really helps us identify that, and then work with Elder Protective Services to make sure that it gets resolved.
It is truly in a lot of ways, a vulnerable population in that, and unfortunate things happen too often, and that's why our seniors need advocates as much as possible. And the other thing is, again, as we have about a minute left, Porchlight, like Elder Services, a nonprofit organization. Holly, why is that important?
Well, it's important because we want to give back to the community. We're very invested in the community, and we rely on donations from family members, communities, businesses to keep the organization going and to be able to provide care for those who can't afford to provide it. There's also a lot of technology now, like the telemonitoring program, that is not funded by insurance, but yet helps to keep the patient safe at home and lowers the cost of care.
And we've raised dollars to make sure Porchlight has that service to the community. And that's what being a nonprofit is all about. So, John, real quickly, as we have just a little bit of time left, you do have a newspaper, the Berkshire
Berkshire
Senior.
Senior, and we also have
publication.
Berkshire Senior TV, and those are avenues for us to get information out into the community that carries everything from menus to caregiver help to all our programs and all our contact numbers. So both of those, and then we have our website at esbci.org.
esbci.org. John Lutz, a great pleasure. And Holly, how can people get in touch with you
They
and
can
learn
give
about
us a
Porchlight?
call at 413-243-1212 or get in touch with us on the web at www.porchlighthomecare.org.
It's a great website. And so thank you very much, Holly. It's a
Thanks,
great pleasure,
John.
of course, on our show. And
Thank you.
John Lutz,
Oh, thanks, Holly.
we'll definitely bring you back very soon.
Anytime.
So thank you very much. And this has been Porchlight, a presentation of Porchlight VNA and Home Care. I'm John Krol. Thanks for watching.